Welcome to the EAUN podcast edition of EAU Podcasts. In this EAUN podcast episode, we are delighted to be joined by Marta Marchetti, Carmine Civilli and Susy Dal Bello. Together, they will discuss implementing a nurse-led flexible cystoscopy program in Italy. Join us as we embark on this informative journey.
Welcome to this EAUN podcast of the Special Interest Group of Endourology and Robotics. Hi, I'm Marta. I'm the co-chair of the Special Interest Group of Endourology and Robotics, and today I'm here with Carmine Civilli, surgical care practitioner from Manchester in UK, also member of the Special Interest Group and person in charge with the podcast for the group.
Good morning, Marta. It's such a great pleasure being here today.
On today's session, we are going to talk about implementing advanced nursing practice in endourology. In specific, the implementation of flexible cystoscopy performed by nurses in an oncology institute in Italy. Today we are here with Susy Dal Bello.
Hi.
Okay, let's start this session then. Okay, welcome everybody. So, Susy, can you please introduce yourself, tell us about yourself, where do you work, what do you do, and tell us about your project.
Yeah, I am the nurse manager in the endoscopy unit, and I work at the Veneto Institute of Oncology in the north of Italy, and I'm specialized in the endoscopy unit and urology procedures.
And how did this project came up? It's such an interesting project, such a pioneering experience for all nurses in Italy, I think.
Yeah, so this idea started 3 years ago when I came to my first European Congress, and I heard from the first time that a nurse was performing cystoscopy in the UK context. I started asking myself, so why cannot we do that? So I started studying on how I could implement these procedures in the Italian hospital.
Very interesting.
Susy, thank you so much. Your project is very interesting. We know that nurses are increasingly expected to practice basing on evidences, but yet many clinical environments still heavily rely on tradition and on the phrase, "This is how we always done it." I wanted to ask you so. Have you encountered resistance to implementing cystoscopy when performed by nurses? Especially in Italy, where I personally know this is something difficult to implement.
Yeah, of course I found some resistance, and I found them even from nurses and from physicians, but for different reasons, I suppose. Nurses felt uncertain about their technical abilities, especially while stepping into a role traditionally performed by doctors or physicians and urologists. So this lack of confidence often stems from limited exposure to specialized procedures during training. And I think that, on the other hand, urologists were resistant because they saw it as an endorsement of their professional domain. So in some cases, they was even not really happy, I would say, of sharing their expertise and their field of procedures. I think that change something is really difficult in Italy, but everywhere maybe. I think that we just have to find how we will change things in our field. And the first step is to engage a special member of the team. So the opinion leader or the team leader, they have to know which are benefits expected from this changement or the development of the introduction of these new procedures. And then we have to enroll even urologists, not only nurses. They have to accept these changes.
There are 2 points here, the nurses not being confident and also the doctor's involvement. So you have to fight 2 battles here. Oh, it's very interesting.
I talked with my director, so the urologist director, and he agreed with me. I don't know why. He agreed with me, and then we started this process. So we came here together at the Congress last year, and we underwent hands-on training with doctors assisting us. So they were enrolled in each steps of the development of this process.
This is a great example of putting everyone on the same page and going through the process together with the support of the team. I mean, the full team. It's not a single effort.
I will add something else. I know that I am a nurse manager and I am practicing a special role into the team. I said that if you feel safe in performing this procedure, then all the team members will feel the same safety. If they feel that there is something that will scare themselves and they are afraid of, they will feel uncertain in doing that. But if you just share the safeness, they will follow you.
They will support you.
Yeah.
And so you use the EAUN flexible cystoscopy hands-on training.
Yeah, of course.
That's important that you mention it because the whole meaning of the EAUN courses is to teach skills that are certified and they give confidence to nurses in their practice. EAUN try to set the standards so then people can go in their country and replicate these courses.
Yeah, because in Italy we need something that is certified for. So we need a certification for a training program or specialized advanced management of skills and capabilities. So this certification allowed us to implement and to develop this process.
Thank you, Susy. And I just wanted to ask if you think that the EAU hands-on course was enough to start, or you felt the need for more exposure and more experience, maybe with other courses before starting?
Yeah, great question. So I think that performing hands-on training was just the first step for certificating the starting of this training pathway. And then for sure we have to implement training program in our hospitals. So nurses has to perform under supervision more flexi than just morning. But we translated guidelines coming from the UK into our experience, and it is everything detailed in the guidelines. So we just follow the steps that are written down in the UK guidelines, and it takes some months or anyways specific number of procedures to be performed by nurses before you can just allow them to perform autonomously.
That's great, Susy. Thank you very much. I've got another question for you. With nurses specializing more than ever, do you think that we are heading towards a future where generalist nursing will disappear?
Yeah, I don't think that generalist nursing will disappear, I do believe we are moving forward a more structured differentiation for nursing's roles. And the healthcare landscape is becoming increasingly complex because we have advancement in technology, in treatment, everything like that. So the demand for specialized nursing is rising. We see that in countries like the USA and the UK, we already have the development of advanced nurse practitioner or specialized nurse, clinical nurse. And these roles allow for a greater degree of expertise and autonomy in specific areas, such the oncology or the urology or the cardiologist, the echographist. Anyway, I think that generalist nurses remain essential, particularly in settings like primary care and any hospital wards. So the challenge is to ensure that generalist nurses have sufficient recognition and career progression opportunities too. So a well-defined framework will allow all the nurses to choose between remaining generalists or specialize themselves in some kind of field with appropriate training and even salary progression. Then it will be that way, I suppose.
We need a revolution here. We need to change the system, basically, and organize it to make sure that all skills are valued.
Even in Italy, we have a movement coming from nurses that want to see the recognition of advanced competencies for nurses. So the first steps for the implementation of specialized nurses with a university degree we will reach them in some years maybe. But generalist nurses will always remain. We need them.
Step by step, we need to value all type of nurses and try to implement specialized nurses. It's a journey and it just starts.
Yeah.
Okay, moving to the next question.
Susy, I gave a look at your wonderful work and your publications, which I invite everyone to look out for. Your work is at the intersection between clinical care and research. And I wanted to ask you, how do you reconcile evidence-based practice with the art of nursing?
I think that evidence-based practice and the art of nursing are just complementing each other. So research and guidelines provide us with the best available knowledge to ensure safe, effective, and standardized care. Without evidence-based practice, we risk making decisions based on outdated tradition or personal bias, and we're not performing proven intervention. But at the same time, nursing is more than just applying protocols, I think. And every patient is unique with individual preferences, fears, and social contexts that influence their care. And I think that the art of nurses is something that we have to adapt with scientific knowledge, and we have to adapt the art of nursing to the real world situation, ensuring care, remaining compassionate, personalized, and holistic care. So one of the challenges in integrating research into practice is the gap between the university and study beside nurses. So we have many nurses that struggle to apply research findings because they do not have time enough. We find some institutional barriers or lack of confidence maybe in interpreting scientific data. I think that filling this gap requires better education on research literacy, and we have to be supported by our leader and a culture that values continuous learning and critical thinking. I would say that nursing practice is one that blends science with human connection, and we use evidence as our foundation, but we have to put always the patient in the middle of our care.
That's a great answer. Thank you so much, Susy. This is a great amount of knowledge and experience you're sharing with us. Thank you. And there it is, the last question for you, Susy. Do you think nursing education is focusing too much on skill acquisition and maybe too little on emotional intelligence in reflective practice?
Yeah, I believe that nursing education has traditionally placed emphasis on technical skills, learning how to administer medication, how to perform procedures and follow clinical protocols. While these are, of course, essential, there is often less emphasis on developing emotional intelligence, resilience, and reflecting practice. Nurses work in high-pressure environments where they constantly deal with human suffering, ethical dilemmas, and complex interpersonal dynamics. Many nursing programs don't adequately prepare students for psychological and the emotional aspects of the job. So stress management, conflict resolution, and self-reflection should be integrated into training, not as optional soft skills, but as the core competencies too. So one of the most effective way to develop these abilities, I think, is through simulation and structured debriefing. So simulation allows students to experience realistic scenarios in safe environment, while we have that debriefing helps them to process their emotion, help them to analyze their decision making, and they could learn from their mistakes. So when this approach is well done, it does not only improve technical performance, but also enhances critical thinking, the teamwork, and emotional resilience. holistic nursing care requires more than technical and clinical expertise. It requires self-awareness. It requires adaptability and the ability to connect with patients, with all the members of the team on a deeper level. I think that this model of training will be implemented in our university programs and in our training programs.
Thank you so much, Susy. Carmine, do we have any more questions?
I've got no more questions, Marta. I'm absolutely happy. And again, Susy, thank you for sharing your experience. That's an amazing load of knowledge. So, a massive thank you.
Well, thank you.
Thank you so much, Susy, for being here and for sharing your outstanding project. To all the listeners, if you want to contact Susy or if you have any project that you would like to discuss on this podcast, please contact us via EAUN webpage. We are always looking for new members, for people that are involved in endourology or robotics in urology at any stage of the patient's care in urology. Thank you so much for listening and have a good day.
Thank you.
Bye.
Bye-bye.
Thank you for this insightful episode. We are sure our listeners enjoyed it. To keep up with the latest EAU podcasts and stay informed on urological advancements, be sure to subscribe to our EAU podcast channel on your favorite podcast app. Until next time, keep learning and stay inspired.